Hello and welcome to Doncaster Talking Therapies Long-Term Conditions. If you're watching this video, you'll have referred to our service and have your initial assessment booked. We're here to explain a bit more about what we do at Talking Therapies and to let you know what to expect. Our specialised service is made up of a team of clinicians who deliver talking therapies to treat common mental health problems such as low mood, stress, general social or health anxiety, obsessive compulsive disorder, post-traumatic stress disorder and specific phobias which may have been triggered or maintained by a long-term physical health condition. In turn, these could be worsening your mental health. These conditions include cardiac, dermatology, diabetes, functional neurological disorders, multiple sclerosis, musculoskeletal, persistent physical symptoms and respiratory. You should have an initial appointment booked with us. This can take up to an hour to make sure we know how best to support you and listen to your needs. It's a one-to-one appointment with one of our psychological wellbeing practitioners, or a PWP for short. Your PWP will introduce themselves, the service, and talk about confidentiality. They'll ask you some questions and get you to complete some questionnaires. You'll also be able to talk through your current difficulties and what's brought you to Talking Therapies, plus discuss your goals for treatment. Have a think about what you hope to get out of treatment, what feeling better may look like to you, and what it is you'd like to change. This initial appointment ensures we can get all the relevant information about how you're feeling and your symptoms so we can make the right decision about the care you receive going forward. This helps determine whether Talking Therapies can support you with your current difficulties or whether we signpost you to another, more appropriate service. At the end of the appointment, your PWP will talk you through the next steps and possible treatment options, whether that's with us or a different service that's better suited to your needs. At Talking Therapies, we offer a range of proven treatment options, including guided self-help, group work, cognitive behavioural therapy and counselling. All of these therapies are not simply talking about your problems, they're doing therapies. This means that you have just as an important role to play in the process as well as your therapist. Setting realistic goals and working on these in between sessions with the support provided by a therapist is required for you to be fully engaged in your treatment plan. Your therapy appointments with Talking Therapies can take place either over the phone, through video conferencing or face-to-face. We also offer home visits for people who are physically unable to attend in person, or we can mix both, depending on what suits you. However, there can sometimes be some limitations on locations and times for face-to-face appointments. If you're looking for medication, screening, a diagnosis for more severe mental health disorders such as psychosis, personality disorders or bipolar disorder, or advice around your physical health condition, we recommend you contact your GP in the first instance, who'll be able to refer you to a secondary service, a physiotherapist or a service better suited to your needs. When dealing with difficult life situations, it's quite common for people to experience distressing thoughts of self-harm or even suicide. If you're having these thoughts and feel at risk of acting on them, it's very important you reach out for help. Talking Therapies doesn't offer a crisis support service, but there are a range of specialist services that can help. You can call the Doncaster Crisis Team on 0800 804 8999 or the Samaritans on 116 123. You can also text SHOUT to 85258 for crisis support via text message. You can also go to A&E. It's also common in times of difficulty for people to turn to or increase their dependence on alcohol or substances. While we do work with people who use low levels of alcohol and cannabis, or those who are stable on a treatment program for other substances, you should be mindful that excessive dependency will interfere with the therapy process, and it's likely you would first benefit from support from Aspire Drug and Alcohol Services, 03000 213 900, Narcotics Anonymous, 0300 999 1212, or Alcoholics Anonymous, 0800 917 7650. In the meantime, while you're waiting for your assessment appointment, you can visit the Talking Therapies website and look at a range of self-help guides and information that might be of some help at talkingtherapies.rdash.nhs.uk.